What's up, PT people? The title of today's article is Shoulder Pain and Rotational Range of Motion of the Trunk, Shoulder, and Hip in Baseball Players, and that's by Kim Yo. So we'll start with a conclusion today, just so if you don't feel like listening, I'll tell you straight up. Authors state we found no clinical relationship between shoulder pain and rotational range of motion and no clinical differences in rotational range of motion values between players with and those without shoulder pain. All right, so with that being said, it's not as clear cut as that. One, I'm just reading from the abstract here, which isn't the clearest of abstracts, but when we get to the results, you'll kind of see what I'm saying. So for context, the authors state deficient glenohumeral rotational range of motion is a risk factor for shoulder pain. Adapted range of motion of the trunk and hip in response to loss of glenohumeral range of motion has been suggested, as the nature of baseball leads to range of motion adaptations. The objective of this study was to compare the bilateral rotational range of motion values of the trunk and glenohumeral and hip joints in adolescent baseball players with or without shoulder pain, and to measure the correlation between shoulder pain intensity and bilateral rotational range of motion values for each body area. So basically that's saying if your shoulder hurts and you can't externally rotate your arm as much, are you going to compensate with trunk and or hip rotation range of motion? There's 95 adolescent baseball players that participated in the study, 60 with shoulder pain, 35 without shoulder pain. The main outcome measures were bilateral trunk rotation, internal and external rotation, and total rotation of the dominant and non-dominant glenohumeral and hip joints. The results: glenohumeral and hip range of motion did not differ between groups, and pain intensity and rotational range of motion were not related in either joint. Trunk rotational range of motion was greater in the pain group than in the control group, with the dominant and non-dominant sides being 6 to 7 degrees more. However, 6 to 7 degrees is considered clinically small. There was a positive correlation in all players and in those with shoulder pain between shoulder pain intensity and trunk rotational range of motion toward the dominant side. So although the strength of this study may be low, I think we can see a correlation, and it's just one more piece of the puzzle that we have to keep an eye out for in watching out for potentially thoracic injuries. Please like and subscribe if you enjoy this content. I'm going to start posting a little bit more, maybe 3 to 5 videos a week, and hoping to have some guests on here soon to review these articles. Have a good one.